Good afternoon, everyone. My here talk is about discussing advances and innovation in AI, particularly that has been done in the field of medicine and other healthcare sector as well. Typically, my presentation is based on, first of all, discussion of the advances that have been done overall in AI for the past few years, and then I'm going to discuss some of the case studies as well that have been done in medicine, in, for example, imaging and diagnostics, in wearable devices, medical devices, and also how AI has helped in, for example, easing most of the administrative as well as management workflows that have been done in the healthcare sector. And then I'm going to discuss some of the gaps where we are working right now and what is the future trend of the overall intervention of AI in, for example, health sector. So AI has been emerged as one of the remarkable innovation in the past few years. It's not new, it has been done in, for example, decades ago, but the realization of AI is something which we see right now, and this is based on the advances in the computation as well. So AI has not only changed or improved many of the workflows in healthcare, but also in other fields as well, like other fields of engineering, business, so on and so forth. When we particularly talk about the advances in AI for the healthcare, actually we can see that the progression of the investment that has been done by the different organizations and the ease which have been provided in the different workflows related to healthcare is, exponential. Normally, for example, if we just see the trajectory for the investments that is going on, for example, in 2023, 2024, and up to 2032. The cumulative average annual growth rate we see is up to 44%, which is really remarkable. That really shows the potential as well, how AI can, assist in, for example, assist us in our daily workflows, which we do typically in the healthcare setting. The application or intervention of AI is not particularly limited to, for example, one area within the healthcare sector. It has revolutionized multiple, or it has diversified and improved multiple sections within the, for example, healthcare sector. Like, for example, now we have robotic-assisted surgeries, we have diagnostic. Diagnostic has been something which have been done in the past decades as well, but how it has been improved, we're going to discuss that as well. Then, for example, AI has improved clinical trials, it has improved report generation and clinical documentation. And apart from this, AI is provided as a solution as well as it is provided as a service, which is very cost effective and very easy to integrate in the existing workflows. And it provides a lot of ease for the, for example, for the clinician, physicians, as well as for the healthcare workers which are working, which work in the, for example, clinical environment. If you look into the statistics of the North America, the investment that have been done in the incorporation of AI in the healthcare sector is also, quite handsome. And these things indicate that AI is, revolutionizing and making most of the workflows that we have in the healthcare, very, very, very well. Apart from this, AI is also being incorporated in some of the machinery and some of the standards which are developed or manufactured by different healthcare industry as well. For example, one of the example is PXAI. It's one of the system that introduces or that uses AI in automating many of the workflows that is being done in the regular healthcare setting. So now I'm going to discuss some of the case studies which have been presented in order to showcase the advances of AI. Most of the things have been discussed by my colleagues, Dr. Israr and Dr. Nofal as well. AI has, improved and personalized medicine. One of the main key areas is like it actually helped us, develop the solutions based upon the person's information, person's genome information, plus person's clinical data, just to provide personalized treatment and to improve the overall treatment and the medicine workflows as well. AI is also being used now in drug discovery. Where actually most of the simulations are done based upon AI, and then they come up with the new drug structures, and that can really help in preventing the diseases. For example, one of the remarkable work which have been done in this field is by MIT, and that is the development of the helicin drug. This drug actually is typically used to cure cancer, and actually it has advances and it shows promise actually towards treating cancers as well. And I mean, intervention or integration of AI typically reduces not only the time, but also the cost as well. And it gives really personalized treatment through which we can really improve the patient recovery process and, I mean, save the lives as well. Apart from this, the advances of AI in imaging and diagnostics is something which is, I mean, very favorite for us computer scientists and computer engineers, because this is the area where we can really plug in and actually contribute. As Professor Nofel mentioned in his talk, actually, AI is, I mean, from the perspective of an engineer, is nothing but the numbers and the numbers which we deal in. Even most of the images, for example, which we have, like we have computer tomographies, ultrasounds, MRI, OCT, histopathology. Now, all of these images are kind of examination tools which clinicians use in order to, you know, study the disease, prescribe medication, so on and so forth. But for an engineer, I mean, these are just numbers. And for AI, they are also numbers as well. So we actually apply, I mean, most of the statistics and mathematical rules in order to come up in the way in which we can analyze the pattern in the data, and from the pattern we, you know, screen the abnormalities and grade the abnormalities, so on and so forth. Now, this is one of the area which actually has embarked in many sectors of healthcare. For example, radiology. We have a lot of literature as well, where people have worked on diagnosing or proposing AI system which can screen the abnormalities in, for example, X-ray, in MRI, in CT, so on and so forth. Similarly, the advances of AI has emerged as one of the, I mean, remarkable way in ophthalmology as well, where, I mean, scientists have used AI, or they have proposed AI in order to screen retinal diseases, in order to screen corneal diseases, so on and so forth. It is actually emerged as one of the major indicators in dermatology as well, to predict skin lesions and skin cancers as well. Pathology, as discussed by Professor Nofel, actually it has shown wonder in that field as well. So, I mean, most of the work which have been done related to AI is within imaging and diagnostics. Now, there are many limitations as well, where people are now working here as well, which I'm going to discuss later on. But this is one of the areas where AI has penetrated most within the healthcare sector. Then AI, recently, this is one of the things where people are working now, is developing the devices which are portable, which are cost effective, and which really gives results based upon the, I mean, the clinical significance, and based upon the clinical acceptance criteria that uses AI in order to do initial or regular screening or monitoring. The benefit of such kind of devices is that people or patients or subjects can use these devices at their home, at their office, or anywhere in the world in order to do regular screening. Because, I mean, most of the diseases that happens, actually, they happen in a very late stage. And at that time, it becomes very difficult to fully recover a person. So such devices plays a very useful role in such scenarios, that it can keep people aware of their current health situation. And now people are investing a lot in in building and manufacturing these kind of devices as well. And that includes edge AI solutions. Now, AI is something which we know that is computationally hungry. It requires a lot of computation. But how we can deploy feasible and scalable and you know, cost computationally efficient AI solution on the edge, which can be deployed on the resource-constrained devices in order to develop the systems which can really, I mean, come up as a on-the-fly solution that users can use in order to regularly monitor their health condition. And such kind of devices are being developed rapidly in the recent years. Yeah. Then AI is used as a kind of a tool that can ease the load of, lead the administrative and management loads as well. AI is now being integrated in most of the hospital management systems as well. AI, again, along with robotics, is used in order to perform surgeries and other intervention tasks. When combined with telemedicine, it actually provides a way in which doctors don't necessarily have to be in an operation theater in order to perform operations. They can use telemedicine and robotic manipulators in order to perform the surgery and other clinical workflows. AI is being used in order to make schedule, to make planning as well, using machine learning and deep learning solutions. Natural language processing, which is again a branch of AI that deals with human languages and understanding and you know, communicating in a human languages with human or with machines as well. such kind of NLP solutions are being developed in order to understand or in order to summarize clinical documentation, in order to generate reports based upon the clinical standards. AI chatbots, like we have GPT, we have like Llama, we have, for example, DeepSeek. Now AI chatbots are being personalized. They have been tailored in order to meet the specific need of the hospitals as well, that are integrated itself within the hospital management solution softwares. So AI is being used for the predictive analysis, for bed allocation, scheduling, so on and so forth. So I mean, this is another area in which AI has emerged as one of the remarkable tools to ease the existing workflows. Now, what are the research gaps actually? We have seen that AI has advanced or AI has become one of the things that actually eases a lot of workflows, and it comes as a very handy solution. But there are some factors which are still need to be addressed. For example, AI, as we mentioned before, AI deals with numbers. It only sees numbers, patterns in the data. But those numbers might or might not be clinically significant. For example, if the AI takes an image and it predicts the abnormal region, or it shows the abnormal region, then those numbers are seen based upon or those patterns are seen by the AI based upon the anomalies in the numbers. Now, those anomalies might or might not be clinical relevant as well. For example, in the image, there can be a section in which there is a vendor annotation, or there is some mark which is kind of a error that has been, or it's kind of an artifact which has been added due to acquisition error, so on and so forth. So how we can make AI to give clinically significant results? I mean, the results which are clinically meaningful and relevant. This is something where people have been working on to develop attention models. So that the model actually gives attention only to the region area which shows abnormal symptoms, or the lesion itself. This is one of the areas where actually there is still need to contribute and develop more AI contextual aware models. Sorry. Then there is a need to avoid fine-tuning and retraining processes. One of the limitation of AI is that it is computational hungry. It requires a lot of computational power. It requires a lot of data as well. I mean, this is something which sometimes may not be a feasible solution. I mean, generating or annotating the data is something which we don't want. And for example, if we have trained model to perform one particular task, how we can adapt that model to learn more tasks. Okay, so I mean, there is a need to develop lifelong learning system as well that adapts like us without requiring, ground truth. So how can we train the model without requiring ground truth, or without requiring data itself for retraining and fine-tuning purpose, to avoid such kind of retraining and fine-tuning ground? This is something where actually people are now working on as well. And how we can incorporate clinical factors as well, or clinical input, or clinically significant input as well into the AI workflows. This is something which actually needs more work, and which this is the area in which people are working on. So, for example, explainability is something which is very necessary when we try to, develop or validate any AI model. So, for example, now here people are working on developing attention model, explainable models that actually focuses, on attention, on not only on the whole scan itself, rather on for example, the area which they actually focus on. What is actually that area? Is it something which is, not clinically relevant, or is it something which is related or to the disease itself, or is it related to something which is clinically significant? So such kind of attention models are now being developed that possesses the capability to focus on the context of the scan, or context of the disease, or context of the abnormalities, while indicating a lesion, or predicting something into the scan as well. And then this is something which actually can correlate with the clinical standards as well. Vision language model. This is one of the remarkable thing which have been done right now. Professor Noswell also talked about this in his talk as well. Vision language models have the capabilities to take clinical input as well. So the AI models, which are vision language models, they don't take image as an input. They don't take only the scan or video as an input. They also take the notes as well. They possess the capabilities in which clinicians can add their notes, the patient history, so on and so forth. Such kind of input, such kind of a meta information can be also included within the decision-making process of an AI model as well. Now, this actually aligns better the diagnosis or the segmentation which AI model do, along with more as per the clinical standards as well. So, I mean, these kind of models, they are multimodal models. They don't actually based on image as well. They are based on the clinical data as well. So, thank you very much. Actually, my time's up. So, thank you. And I guess we can